Hello, I'm Jackie Dyer, Vice Chair of Thrive London, and I'm very excited to be introducing this short film about our Londoners Like Me Said report. Working with the Mental Health Foundation, we've held 17 workshops in half of all the London boroughs and spoken face to face with nearly 1,000 Londoners. We've collated all their ideas, and what you're about to see and hear are some of those Londoners describing the most popular ideas that came out of the workshops to support London to thrive. You can read the full report at the Thrive London website.
Londoners like me said that we need an army of community health champions, volunteers trained and supported to talk to their neighbours, to tackle isolation and support healthier behaviour. There are lots of things communities can do for themselves, but we must empower people to share responsibilities.
Londoners like me said that there is a diagnosis at the door culture which restricts access to services for people who need support. That we need to move away from just the medical model of mental health and put more emphasis on the psychological and social aspects that can either push people into distress or protect them. That we need to improve awareness of mental health at an early age, ensuring schools are equipped to educate children about how to stay well and what to do if they feel distressed.
Londoners like me said we need to ensure that there are safe and free spaces for children and young people to meet. In those spaces and schools, we need to diverse and realistic role models for young people to learn from and be inspired by.
Londoners like me said, all employers should be trained on supporting good mental health. More needs to be done to tackle macho cultures, particularly in the city and in construction. Trade union membership should be promoted so that people feel protected. And lastly, we need to do more to tackle stress and abuse experienced by Transport for London staff and particularly our bus drivers.
Londoners like me said that services need to be in and part of the community. We need to move them out the big buildings and to places where people actually want to go. We need support and we need services outside of the working hours. Evening sanctuaries and technology have had much more of a role to play. We need to activate the community, help them to understand how to support good mental health and people with mental ill health.
Londoners like me said that we need to reach out to high-risk groups like younger men of a working age through their sports, particularly going out to pubs and bookmakers and start to have conversations with them about mental health and suicide. We need more community hubs to talk about issues and bring people together. And we really need to bring a strong network of parents and equip them to talk to teenagers about mental health and to nip any potential crises in the bud.